So what happens when a totally routine brain scan finds something, well, completely unexpected? Today, we're going to demystify a medical term that sounds pretty alarming, but it turns out usually isn't: the pituitary incidentaloma. We're going to break down what it is, how often it's found, and most importantly, what happens next.
Okay, picture this. You go in for a brain scan for something that seems totally unrelated, right? Maybe a nagging headache or you took a minor tumble. You get the report, and buried in all that technical text, you see the phrase incidental finding. I mean, that's a moment that can cause a ton of anxiety. So what does it actually mean?
All right, let's dive right in and just break down the term itself. What exactly is a pituitary incidentaloma?
Well, according to our source material, a pituitary incidentaloma is a lesion found incidentally, basically by accident. Now, the most important words here are unassociated with symptoms and benign natural history. What that means in plain English is, it wasn't causing your headache, and it's expected to be completely harmless. It's a finding, not automatically a problem.
To really get this, you have to look at the big picture. These things are surprisingly common, but the chance of any one of them being an actual problem is incredibly low. Let's look at the numbers, because they really tell the story here.
So check this out, it's a pretty staggering statistic. Autopsy studies, these are done on people who passed away from totally unrelated causes, have shown that as many as 1 in 5 people have a tiny, completely harmless pituitary spot that they never ever knew about.
And this isn't some old finding from decades ago. Modern, super high-resolution MRI scans of perfectly healthy volunteers show the exact same thing. About 10%, or 1 in 10 people, have one of these tiny pituitary lesions. So you see, our technology hasn't created these things, it's just gotten way better at seeing what's always been there.
And this brings us to the most important point of all. While maybe 1 in 10 of us has a tiny, harmless speck, the rate of clinically significant pituitary tumors, the ones that actually need treatment, is only about 1 in 1,000. This just highlights the huge difference between simply finding something and that something being a real problem.
So, the scan found something. Okay, what happens next? Let's walk through the investigation process and see how doctors approach this kind of finding. The very first thing to get your head around is the goal here. The follow-up isn't some frantic search for a hidden problem. Nope. It's a calm, methodical process designed to confirm that the finding is exactly what they suspect it is: harmless. The investigation really has 3 clear goals. Number 1, make sure the little lesion isn't pumping out extra hormones. Number 2, double-check that the rest of the pituitary gland is working just fine. And number 3, make sure it's not physically pressing on anything important, especially the optic nerves, which are, crucial for your vision. And to do all that, they'll run a series of blood tests. These check a whole range of key hormones, things like prolactin and others that regulate your growth, your thyroid, your stress response. It's a really comprehensive panel, and it's all designed to just confirm that your pituitary is humming along normally.
Okay, so let's say the blood tests all come back normal. Now we get to the big question. Do you treat this thing, or do you just watch it? Well, it turns out there's one main thing that helps make that decision.
And that deciding factor is, quite simply, size. Yep, how big the lesion looks on that MRI scan is pretty much the most important piece of the puzzle for figuring out the next steps.
Now this slide is really crucial. Findings are basically split into 2 groups. A microadenoma is anything less than 1 centimeter. A macroadenoma is anything bigger than that. And just look at the difference in the chance of growth. It's super low for the small ones, but it is higher for the bigger ones. And that, right there, directly tells you the management plan. For the vast majority, which are the micro ones, the plan is simple observation.
And this is totally backed up by clinical guidelines. This quote here from our source material confirms it. A watch-and-wait approach is standard practice for microadenomas. The key isn't jumping into action, but just careful, periodic follow-up.
So, what does careful follow-up actually mean? In the real world, what does a watch-and-wait plan look like for someone? Let's break that down.
So here's what it typically looks like. For a small lesion, one that's under 1 centimeter, the plan is usually another MRI after a year, then 2 years, then maybe 5 years, just to confirm it's stable. If it's a larger one, the monitoring is a bit tighter at the beginning. But in both cases, the goal is exactly the same: confirm that it isn't growing. Of course, sometimes treatment is needed. So what are the triggers for taking action? Well, there are really only 2 main reasons. 1, if those blood tests show the tumor is overproducing hormones, or 2, if it gets big enough to actually press on the optic nerves and mess with your vision.
For a true incidentaloma, these outcomes are pretty rare.
So here it is. The crucial point, the main takeaway from this whole explainer is this. The overwhelming majority of these incidental findings are stable. They don't grow, they don't cause hormonal chaos, and they simply need to be monitored, not necessarily treated.
And this leaves us with a bigger question to think about. Our imaging technology is getting so powerful, we can see smaller and smaller details inside our own bodies. As we inevitably find more of these harmless little variations, the real challenge for all of us, doctors and patients, is going to be learning how we get better at worrying less.